If you know of somebody who is a loud snorer, it could be a sign of a bigger medical problem. It might be just loud and annoying to you at first, but it could be a sign that there could be bigger things on the horizon. So we have Dr. Daniel Thielemann. He is the First Coast Cardiovascular Institute. He is here to explain how sleeping disorders can affect your body and what to do and how you could get tested. Dr. Thielemann, thank you so much for being here. We appreciate you guys at First Coast Cardiovascular Institute for being here. Let's talk a little bit about, snoring, because obviously we all have that family member, we're going to say, oh, we can hear them snoring or whatnot. But it could be a sign of something bigger. That brings us back to the topic of obstructive sleep apnea. A lot of people have heard about what that is, but what exactly does that mean to have obstructive sleep apnea?
Obstructive sleep apnea is a type of sleep-disordered breathing. It's characterized by repetitive collapse or narrowing of the upper airway that occurs during sleep, causes disruptions of breathing, and can predispose you for other medical problems. It can also disrupt your night's sleep, and so for these reasons it concerns physicians.
What are some of the characteristics if someone is watching right now and they're thinking to themselves, I snore, or my husband or wife snores? What are some of the characteristics that would lead one to believe that they might have this?
Well, there are several.
Okay.
And if you're concerned that you might have obstructive sleep apnea, then you should discuss your suspicions with your doctor. There are four big clues to my way of thinking. There is snoring, there is excessive daytime sleepiness, there is having a large circumference or diameter neck, and there is being overweight. Now, a bit more about these things. When we say snoring, just because you snore, that doesn't mean you have sleep apnea. But it does make us think of that. And what really makes us think of sleep apnea is that terrible loud snoring when you hear someone on Sunday afternoon with the door shut and they're halfway across the house, but you still hear them snoring.
Yeah.
So that's the type of thing that makes us suspicious.
Very loud. We're not talking about like the subtle, just breathing that you might hear that might not.
In truth, it can be soft snoring, it can be loud snoring, but generally speaking, the louder, the stronger a clue it is.
Okay.
The second one was excessive daytime sleepiness, and what this means is you are tired during the day and you actually fall asleep because you are tired. It's not just being fatigued or being tired. And this, having had a good night's sleep the evening before, and for appearance sake you're getting appropriate amounts of sleep, and yet you never feel refreshed. You're still falling asleep, perhaps in inappropriate situations during the day. The last two things are neck circumference and weight. Now, by neck circumference, what we usually look for as physicians is a circumference neck that is 17 inches or greater in a man, or 16 inches or greater in a woman. And your doctor's office can do this for you, or if you go to a sleep laboratory, they can do this for you, but it just involves putting a tape measure around the neck, mid-neck, around the level of the Adam's apple, and then just seeing what number you get. And lastly, it's being overweight. Now, doctors consider obesity by definition to be having a body mass index, or BMI, of 30 or greater. The BMI is a calculation of your height versus your weight. You can look this up online, very easy to find, very easy to do. In fact, your doctor's office probably checks this every time you go in.
Okay. Now, what happens if someone has OSA, or obstructive sleep apnea, and they don't get it treated? Can it lead to bigger problems, more than just not getting a good night's sleep?
Absolutely. In fact, the more we look, the more we find. There's a very long list of medical problems that have been associated with obstructive sleep apnea. The big ones that I would want people to be sure and be aware of are worsening high blood pressure, increased risk of cardiac rhythm abnormalities, increased risk of stroke, and increased risk of heart attack.
So this is something very serious that you should get checked out immediately, even if you have a suspicion that you think that you might have this condition. And then once somebody comes into the doctor's office, how then do you guys diagnose whether someone has this or not?
So sleep apnea is not what doctors call a clinical diagnosis. It's not based solely on what you complain about or what your physical exam findings are. We have to do objective testing. And for sleep apnea, what that entails is you come into what's called a sleep laboratory and you spend the night. It's like a hotel room. And a technician who's trained puts wires, belts, and sensors on you, and you just go to sleep. And we monitor your breathing, your oxygen levels, your muscle tone, your brain waves. It's not painful. It's not wonderfully comfortable, but
Sure, I mean, you've got these wires and whatnot hooked up to you, but
you can still sleep, and the
Yeah.
majority of people do with no troubles.
yeah. Now, at First Coast Cardiovascular Institute, do you guys have these then places where you can go and these machines and whatnot to get tested to find out if you do indeed have it?
We do. We have
Okay.
2 laboratories that are accredited by the American Academy of Sleep Medicine. There's one that has 2 beds and is on University Boulevard, and we have a second larger lab with 6 beds that is located on Old St. Augustine Road. We do testing 7 days a week, and we can also arrange for daytime testing for people with atypical sleeping schedules.
Okay, so just if you have any suspicion whatsoever, just a good idea to call and check it out.
Talk to your doctor.
All right. Well, thank you so much, Dr. Thielemann. We appreciate you being here. We also want to thank First Coast Cardiovascular Institute for sponsoring this segment. And remember to know your body, know your risk factors, and work with your doctors to address them. If you want more information about obstructive sleep apnea or First Coast Cardiovascular Institute, you can visit their website at firstcoastcardio.com, or you can call them. The number's on your screen. Very easy to remember, 904-493-3333. Well, coming up, the benefits of spaghetti sauce. That's one of the ingredients that one author is advocating to maintain a healthy lifestyle. We're going to go in depth with that. And we spent a lot of time outdoors doing some great decorating, getting in time for the summer months. We're going to have some ideas for you and your family coming up right after the short break.